G'day guys. This is a video on the interactions of taurine with medications. So I did a bit of a dive into what the literature shows in that regard. I checked the FDA site on. They've actually got a site for for medicines and stuff like that, and the way they interact with certain compounds. So that was interesting. The key one was, again, blood pressure. So that was the obvious big one. But there was another one that I was surprised to find out, which I wasn't aware of. And that was due to a question asked by one of my subscribers who takes lithium and also takes taurine. And I knew there was an interaction because it does affect similar pathways, but I didn't really know how that interaction was. So I was surprised to find out that it has an interaction differently than what I actually originally thought. So let's just take a look initially at some of the research in this sort of area, so we get a bit of an idea. As you can see, these are clinical. So taurine as an anti-maniac agent in a double-blind placebo-controlled study. Taurine in adolescents with bipolar disorders. And they've also looked at, and this is in mice with anxiety, but they have done it with humans as well. This was a pretty good study showing that actually, supplementing the inhibitory, the different effects, chronic supplementation in this sort of excitability, that it has this inhibitory effect in the brain. It increases, basically, taurine plays a role in modulation of anxiety and locomotor activity. So it has a lot of things that have to do with the brain function, the calming effect, let me just get rid of that. The calming effect of for the brain. It increases GABA. It has an effect on serotonin, all these sort of things. So it has all these effects, but lithium also has similar effects. So both have similar effects. So really, you could literally replace lithium and just increase the dosage of taurine and get eventually the same effect. So you could actually work with your doctor and sort of, like with the blood pressure meds, change the composition, reduce the lithium and increase the taurine. And the same thing with the blood pressure meds, reduce the meds and increase the taurine content. And as you're working with your species appropriate diet and all that, over time, that regulation of those systems will start normalizing, and also, some of those genetics and all that should basically find their own homeostasis. Like we see with tribal people, we don't see these problems, At what dosages you're going to basically turn off those genes and actually affect them in what length of time, that is something we don't know because there's no research. You would have to experiment with a higher dose and play around and see. So you're looking at probably at dosages between 6 and 10 grams per day divided throughout the day if you're basically dealing with these sort of mania, anxiety, all these sort of issues. But at the same time, you need to be on a species appropriate diet to eliminate some of the trigger foods and stuff like that, and then do these higher doses that actually are really going to affect in these sort of pathways. Now, let me just put my sort of little stuff up. So I'll share this, a little bit like bulletin board type points in that regard. So oops, it's not what I want. The wrong thing. Leave that there. So interaction between meds and taurine. That's the title. So why isn't this working? Okay, now it's working. That's ridiculous. So lithium, moderate interaction rate. Depending on genetics and or high dosages of taurine. So there is a genetic factor to it, because in relation to taurine, its utilization, its uptake, that's a reality, but I won't go into the genetics. It might reduce the rate at which lithium is excreted from the body. So that's what the research and what the sort of FDA, with some of the stuff that they've got, they use the word might. I sort of tend to think that it's more than might, but I have to use their terminology. It's a moderate interaction. So obviously, if you're doing much lower rates, which is what you'd get in food, like a gram or two, you probably won't have these problems at all. But if you're doing higher doses, yeah, probably then you will notice, because what it does is it reduces the excretion rate of lithium. So it can actually build up. So it could increase the buildup of lithium levels in the body. And then you could have those sort of side effects where you go, oh, it's gone too much the other way. Your dosage of lithium and the sort of taurine are working on a similar pathway. So it's like getting a mega dose of lithium compared to, and so that's where I'm basically saying, so caution is required when combining lithium with taurine. So if you desire to lower your dependence on lithium as a med, then talk with your doctor to lower your dosage and slowly adjust it and see whether you can get off it completely, So the goal is to get it back on a species appropriate diet like our ancestors and not be reliant on meds. But as I said, this is an area where I can't give you medical advice. This is where I'm saying you need to manage it with a physician and work out the sort of nuances of that, because it's an area where I have no training in. I'm going, off the seat of my pants, so to speak. So I can't recommend specifically stuff for people with that are using lithium and basically, or similar type drugs that have a similar effect in the brain. While they may not bioaccumulate like lithium, there may still be certain interactions. So you really need to work with a physician to lower those and then adjust your levels of taurine and see how you feel and work with that. And over time, maybe you can get yourself off completely meds. But it's a question of basically working with somebody that knows what they're doing, a physician that's, and slowly making those adjustments and all that. I will leave that up to people who actually have these conditions. And it's not for me to tell them how to manage it. It's just for me to inform you that there is a moderate interaction that is happening and that you need to basically be aware of this issue and need to then basically work with your physician to make the appropriate adjustments to basically work, whether you want to lower it or whether you want some of the other benefits of taurine. But so you may go for a halfway house, lower your dosage, where it's not as high, so it doesn't actually build up in your body. So, or test yourself or stuff like that. I'll leave that up to people to work that out with their physicians who are qualified, who've got the knowledge and the history in that specific area. It's not an area that I've trained, and it's not an area that I've researched to really give any opinion or recommendation or whatsoever. I can only inform you that there is an issue of potential buildup, and so you need to work with a physician to manage that and adjust dosages and whatever else is required, depending on what your goals are in your long-term, life, carnivore lifestyle. Anyway, let's move on to the major one, which we all know about, the high blood pressure drugs, moderate interaction as well, depending on genetics again. Yes, there is a thing about genetics that is important. Things do operate slightly different and the effects can be different between people. So that is why you've got to basically work with a physician to basically get the readings and work out exactly where your blood pressure is, especially if you're doing higher doses. Small doses, like 2 grams, 1 or 2 grams, probably not an issue, because that's just like having 200 grams of, of basically oysters. But it's not as if you're going to have oysters every day, but you know what I'm getting at. It's not going to cause any dramatic issues. But when you're starting to operate in the 3, 4 and above, some people may even be susceptible at 2 grams, so that's another possibility. So you really need to work with a physician and make those adjustments. So as I said, it might, this is again on the FDA site, they say it might. I would sort of, from my own experience, I think it does, but to varying degrees. That's why the might work is varying degrees, and the dosages, so at low dosages, it just might, but then it may not, so there's a whole lot of those question marks. So taking taurine with such meds might cause your blood pressure to go too low, which is the issue, which I've talked about in the past. So don't take too much taurine if you are taking medications for high blood pressure, and work with your doctor to slowly lower the dosage as you increase your taurine intake. And so as you switch to more ancestral approaches in managing your blood pressure is what I'm saying. So these are usually the sort of meds that we're talking about that are generally the ones that, there are other brands as well. I didn't look into all of them. I just got these off the website, so I just copied those. And so I've just said, because they said, and others, and I've said, and many other brands. So I renamed it slightly, but it's the same thing basically, and others. So that's the key thing. Take it. So in terms of the scientific literature, what it's actually saying, the dosages based on science, and these are the recommendations again of this site in that regard. So heart failure is basically 2 to 6 grams per day, and 2 or 3 divided doses. So sometimes people may only take 2 dosages a day, or 3 dosages a day. Like if they're doing 2 or 4 grams, they may do 2 and 2, something like that, or they may do a 6 and do 2, 2 and 2, and divide it by 3. So in the actual take up, so the daily division maybe 3 times a day, 2, 2 and 2 for 6. That sort of stuff is what I'm saying. I sort of leave it up to people to decide how they're going to divide it. My sort of levels are between 6 and 8. That is what I truly believe. And I was doing those sort of dosages when I came out of surgery a year, less than a year after. So that was about a bit over 10 years now. So that was, I was still, at the time, I was still taking even a statin at the time. So this was in those very early days that as I was becoming aware and diving into all these rabbit holes to work out what's required, what are the nutrients that are required for the heart. That's what I was looking at. I came across taurine and coenzyme Q10 and all these things when I was looking at what is in hearts. What are the big things that everybody talks about hearts? And it was taurine, coenzyme Q10, those sort of things. And I'm going, okay, zinc and a few others and stuff like that. I need to get those in my diet, or I need to supplement or stuff like that. And that's how I sort of came across a lot of this information. And I just kept on diving in to see all, and I found a whole lot of other things as a consequence. Anyway, that's a long time ago, in a long chemotherapy side effects. So if you got, side effects post, or these are sort of after you've done chemotherapy, I sort of believe that you should actually if you are going to go down that course, that is up to you to discuss with your oncologist and make that decision. My opinion on these sort of things. I think they can cause a lot of mitochondrial damage, and in long term can have a lot of negative. And there are other methods that I've discussed in my other videos that are probably, if you Google my name with cancer, you'll find these other videos that I talk about these sort of things, and there are other approaches. But I will leave that without actually, because this is not medical advice. It's basically my own opinion. If I had, what would I do? These are things that I would do. But in this case, they are talking about these associational studies, and they were looking at 3 grams daily for 6 months. So to reduce that nausea and a number of other side effects that they had noticed in people. So that was based. I sort of consider doubling that is a better option, going up to 6 grams for 6 months, maybe even longer. And while you're doing the actual chemotherapy, I sort of recommend up to 10 grams. I'm not kidding you. Work your way up to those levels. And because of the really strong chemoprotectiveness. And I've actually done a video on taurine and chemoprotectiveness, so you can actually look at that as well. So there is good research to cover that area. So in that regard, so hepatitis, yes, there are many people around the world that do suffer from hepatitis, and it's basically 4 grams 3 times a day for basically 2 months. And so that will actually deal with a lot of fibrosis in the actual liver. So, and will basically have some effects, positive effects against, again, it also boosts the immune system, as we know, with T lymphocytes. Vitamin D is also an important aspect here, combination to really improve the immune system in that regard to deal with the hepatitis, plus also the fibrosis that it actually causes in the liver and stuff like that. So we need to deal with that. And this does a lot of that as well. So, and also, when we're talking about fatty liver fibrosis, certain other types of fibrosis may happen from alcoholism and stuff like that. This can help. And sometimes, depending on how severe the fibrosis is, going up to even higher levels can be very therapeutic and useful. But anyway, post-exercise muscle soreness. So people sometimes, just overdo it way too much. And, most people that are young are doing sports and stuff like that, 1 gram is probably all they need, because they're still synthesizing and eating shitloads of protein. They may not even really need much more. But if you basically have a lot of soreness and stuff like that, well, consider 2 grams 3 times a day prior to exercise, so, and after meals. And this is what they recommend in the stuff. You can work it out, what suits you. I'm not really that particular. This is how they did it in the studies. I'm just repeating how they said that they did it, and fine, and continued for 3 days after exercise. So post the soreness, doing it for 3 days at these higher doses, which means 6 basically grams, 2, 2, and 2, in that regard, and seems to sort all that. But it's like the heart failure, the more severe injury to the muscle and causing soreness, it helps fix a lot of those problems. So that's why they do recommend those sort of dosages in that regard. Generally speaking, when you're just doing normal exercise and stuff like that, and you don't really have much soreness and all that, they usually recommend just 1 gram or 2 grams a day. So that sort of stuff. If you're older, maybe 3 grams, stuff like that. But as an osmolyte, it does improve things in terms of the electrolytes and stuff like that. So that it plays a role in that aspect as well. How much one with the other? Yes, it does improve, when it comes to muscle fatigue and stuff like that. So there's good research out there in that regard. So there's plenty of it. So this is basically what the key things that are pointed out on the FDA site. So that's the source where they report problems to Food and Drug Administration. So that's their little thing. And basically, that's about it. So I thought it was really important to cover those aspects, especially when I found out about the lithium one, and somebody had actually asked me about it. And I wasn't aware that that it has this ability to build up, sort of reduce the excretion rate of lithium. So if you're doing a slightly higher dose of lithium as a medical for medical purposes, yeah, it could be a problem. Especially with certain genetics where you may hold on to more potentially. No wonder that person really didn't feel that great. So it was holding on to too much, was overdosing on lithium in a sense, because couldn't excrete enough. Maybe it was doing too high dosages potentially. So yes, very insightful and humbling for me to to realize that there was an issue with lithium. I thought there was only one with high blood pressure and nothing else. So anyway, we're all wrong occasionally. We can't be 100% right. Otherwise, we'd be gods. And we're just humble, imperfect humans. So to that person, for by lack of, going down sufficient rabbit holes to cover that area, I hope this information helps them, and then they will be able to, and anybody else in future that is on that sort of medication. And I would also consider if you're on any other sort of medication relating to depression, anxiety, or any of that sort of stuff, I would suspect, because while it may not hold on, like, cause a buildup of that medicine, it still may be metabolized out of the system via the liver. That may still happen with no problems, because lithium is sort of like a mineral. It's not exactly, and this is where I think, because of the osmotic effect, is why it's holding on to it. So it's sort of a different reason in that regard, and not clearing it properly. Where with the other stuff, it's sort of going through the phase 1 and phase 2 detox. It's being eliminated in a very different way. And taurine is playing a different role. It's playing a role within the bile, and the phase 2 stage of detox. That's where taurine is playing a much bigger role. So it's not playing an osmotic effect in terms of the effects on those within the bloodstream and within the system. It's actually playing in terms of metabolizing drugs away in that regard. So I don't think it's really going to be a problem for those other meds, but I would say, just as a precautionary principle, even though the FDA hasn't pointed to that as being a problem, there may be a problem. Monitor it, is what I'm trying to say. If you're taking certain other meds and you're actually also taking taurine, just monitor it and see how, maybe even adjust down the dosages of the medicine and see how you're responding, all these sort of things. So be cautious, because even though it is a food component and something that the body synthesizes, so it's not toxic. We can take there are studies that show excessively high dosages where they've done experiments on animals, and they haven't seen, it healing over and happening anything. It's an amino acid, a sulfur amino acid after all. There are very rare conditions where some people can build up sulfur. That is a very rare genetic. And there, if you're getting enough choline from eggs, you'll methylate that away, that excess. So it won't be a problem. But if you're on a plant-based diet and you're not getting enough choline, then it potentially, with those sort of genetics, could be a problem. And it's not only with taurine, it could be with MSM, sulfur, and other sulfur sources for those people. So you need to, be cognizant of all sulfur sources and susceptibilities. And if you're not getting enough choline in your diet, you may be, somebody on a plant-based diet and eating a lot of sulfur-rich foods like garlic and onions, and you may have an addiction on onions and eat shitloads of onions. Well, that could be a problem to you if you can't clear it properly, so you don't, so you may have those genetics. It's not a dominant type thing in the gene pool, but there are people that do have that susceptibility. So keep that in mind. Anyway, hope you enjoyed this video. I'll leave it at that. See yous.